Hi, I'm Sue, and today I'm going to chat with you about normal breast changes and also how breastfeeding works. So let's talk about normal breast changes first. So it's very normal during your pregnancy to experience some breast growth, and that generally happens because those milk-producing glands that you can see in the image on the screen are starting to grow and prepare for breastfeeding. Some of us might notice veins and pigment changes. So you might notice that your breasts, your chest, and your whole body really seems a little bit veinier than it usually is. And that's just because we're carrying a larger volume of blood when we're pregnant. So we're carrying an extra 50% more blood in our system. So naturally, all our blood vessels are going to expand, and we can see them a little bit easier through the surface of the skin. Pigment changes. So often we can notice a little difference in the breast, in the nipple, and in the areola. So sometimes it can darken in color a little bit during the pregnancy. And leaking of colostrum. So we all have colostrum sitting in our breasts from about 18 weeks of pregnancy. And I'm going to chat with you about breastfeeding hormones in a moment. But put simply, oxytocin is one of our breastfeeding hormones, and it is responsible for our flow of milk. So sometimes during our pregnancy, we can have little flurries where maybe our oxytocin levels are high. And at that time, it can be very normal to leak a little bit of colostrum. So if you are leaking from time to time during the pregnancy, absolutely nothing to worry about. And equally, if you aren't leaking from time to time during the pregnancy, that's absolutely normal as well. It's no indicator as to whether you'll have loads of or not so much milk after baby's born. It's just some do, some don't when it comes to leaking. Next up, I want to chat with you about the hormones involved in breastfeeding. So there are two main hormones that make breastfeeding work. One of these hormones is called prolactin, and the other is called oxytocin. So let's talk about prolactin first. So prolactin is the hormone that's responsible for your milk supply. And the way I remember the name is because pro is an expert, like pro golfer or pro tennis player, and anything to do with lact is milk, isn't it? So prolactin is the hormone that's an expert at making milk. So what we need to know about prolactin is it's going to be produced in really high amounts in that first hour after birth, and then also at nighttime. So every night from about roughly kind of 12 midnight to about 6 in the morning, your prolactin levels are sky high. What we also know is that when baby suckles at the breast, when the prolactin levels are high, that's what really helps build our supply of milk. So it's really important that baby does all their feeds from mum, and really syncs their feeding needs with mum's supply. But it's of the utmost importance, that we really try and get that first feed in that first hour, and that we always feed baby at nighttime when they're hungry. This probably isn't kind of too much of a concern in the first few kind of weeks and months of baby's life, because baby's always going to be with you, so you're just going to be feeding them as they're hungry. I actually think the big time this comes into play is when baby's getting a little bit older, and maybe baby's 8 months now, and you're going to a wedding, and you're away from baby for the night. It's times like that you really need to remember the prolactin. It's important to mimic the feeds that baby would usually do, so that the breasts are stimulated over the course of the night and your supply is maintained. It would be a real pity if the next day when you went to collect your baby, your supply had dwindled as a result of the breasts not being stimulated over the course of the night before. Okay, so that's just a little pro tip about the prolactin. Next up, I want to chat with you about oxytocin. So oxytocin is responsible for the flow of milk, which is also really important. So I want you to think back to our labour and birth class, and you'll remember when we spoke about oxytocin, we spoke about what mood do we need to be in to produce oxytocin. And we learned that we need to be in a calm, happy, relaxed mood in order for our oxytocin levels to flow. Now I want you to think about, like, how do we feel after having a baby? Okay, so sometimes like our stitches can be a little bit uncomfortable. Sometimes we can have like little postpartum cramps in our lower abdomen. Sometimes we can be really thirsty, or we can be really hungry, so, and all of these things sometimes don't have us feeling like that relaxed and that chilled. So in terms of oxytocin, when you start seeing signs that baby's hungry, it's important that before you pick baby up, just check in with yourself. Do you need to go to the bathroom? Do you need to change your maternity pad? Do you need to take 2 paracetamol or 2 ibuprofen because maybe your stitches are feeling a little bit uncomfortable? Do you need to make yourself a glass of water or a snack? And once all those things are done and you're feeling really comfy and calm and relaxed, you're then going to pick up your baby and feed your baby, safe in the knowledge that loads of oxytocin will be produced and that milk is just going to flow beautifully. Okay, so nice and calm when we're breastfeeding. As well, I want to chat with you about the importance of syncing your baby's feeding needs with your supply. Okay, so so when baby's born, okay, we're all going to have colostrum in our breasts, and we're going to have about 5 to 7 mils of colostrum for every feed that baby will do in that first kind of day or 2 or 3. Babies have tiny tummies. Their tummies are about the size of a cherry in the first day or 2 of their life. So 5 to 7 mils of colostrum doesn't seem like a huge amount, I know, but it's plenty for their little tummies. Then what's going to happen is on around day 3, day 4, your colostrum is going to, your milk supply is going to change. So from colostrum to breast milk. And when the breast milk comes in around day 3, day 4, we're going to have larger volumes. Now, the way that your body determines how much milk is going to come in on day 3 and day 4, well, that's all based around how much feeding baby was doing on day 1 and day 2 and day 3. So if you were doing loads of feeding, if every time baby was showing you feeding cues, you were latching them onto the breast and they were feeding and then they were sleeping and then they were feeding and then they were sleeping, well, the likelihood is that the milk that you make on day 3, day 4 is going to be the perfect volume for your baby, because your baby's feeding needs have synced beautifully with your body's supply of milk. So if, for example, baby didn't feed too much from the breasts in the first few days, say, for example, you were doing some breastfeeding and you were giving some formula and some breastfeeding and some formula, the likelihood would be that when the milk comes in on day 3, well, then maybe you wouldn't have the perfect amount of milk for your baby. You would have the amount of milk for your baby based upon the amount of feeds that baby has fed directly from mum, because your body can't account for the formula it had here and the formula you had there, so it's really important to really try and do all those feeds yourself in those first few days to ensure that you have that perfect amount of milk for baby when the milk comes in. And from time to time, like there may be times where baby's a little bit jaundiced, and maybe we need to top baby up or give baby some additional expressed breast milk on top of the feeds. And that's perfect. That's just additional stimulation to the breasts. That's only going to help towards building that supply. So on the screen, you can see 2 images. So you can see colostrum on the left-hand side of the screen, and you can see some breast milk on the right-hand side of the screen. Now look, everybody's milk is different, so this is just a representative picture. But what I really want to show you is the colostrum. Okay, the colostrum, it's usually a yellowish color. It's usually small amounts of thick colostrum that's really high in nutrients and good fats and immunities. And then on day 3 and day 4, your milk is going to come in. So now we have larger volumes of breast milk, usually not as thick as that colostrum. What I also want to mention is, okay, so we mentioned earlier, we have colostrum in our breasts from about 18 weeks of pregnancy. Okay, so at the moment, your breasts are feeling pretty much normal. Okay, so they're feeling very normal to you. And on day 1 and day 2, post-birth, the breasts should feel exactly the same, okay, because we have colostrum in our breasts during pregnancy and we have colostrum in our breasts on day 1 and day 2. So don't be expecting these like big, full, heavy breasts in the first day or two. If they feel exactly as they did when you were pregnant, that's absolutely normal. And then it's usually kind of day 3, day 4 when the milk comes in that we have our first kind of feelings of these kind of heavy, kind of nearly warm, tingly breastfeeding breasts. So I think it's important just to mention that as well, just really for our expectations, just on the first day or two when baby's feeding a lot of colostrum, it's just nice to know that, I don't feel like I have loads of milk there, but that's very normal. And then on day 3, day 4, when the milk comes in, just to know that all those kind of changes, those heavy breasts are very, very normal around the day 3, day 4, day 5 mark. And then what I also want to chat with you about is just a few other kind of pro tips or nuggets when it comes to breastfeeding. So in terms of food and diet, so great news, you can eat and drink what you like when you're breastfeeding, kind of within reason. So all those kind of restrictions that we would have put on you during the pregnancy, no raw fish, no pink meat, no unpasteurized soft cheeses, you can eat them all when you're breastfeeding. So you can sit there breastfeeding with your sushi or with your crackers and your brie. The only things that we'll ask you to remain kind of really mindful of is caffeine and alcohol. Okay, so with the caffeine, we say ideally no more than 1 or 2 cups of tea or coffee a day. You might be wondering, so what happens if I do drink too much caffeine? Often your baby can just get really jittery and not sleep so well. So it's not that nice for them when too much caffeine passes through to their system. Okay, so no more than 1 or 2 cups of tea or coffee a day. And then in terms of alcohol, the rule of thumb would be if you can drive, you can breastfeed. Okay, so if you've had a really small half a glass of wine and you know that your blood would be under the alcohol limit and it would have you safe to drive, well, in that instance, it is safe to breastfeed your baby. If your alcohol levels in your blood would be too high to drive, well, then they're also too high to breastfeed. So if baby's due a feed at that point, in that instance, you would pump that milk and you would discard of it because the alcohol levels in that milk they sync with the alcohol levels in your blood. Okay, once you've reached a point where it's safe to drive again, brilliant, we can feed your baby again. So hopefully that makes sense. In terms of extra calories, so we encourage you to eat an extra 300 to 500 calories a day, and that's to fulfill the energy requirements needed to make enough healthy breast milk for baby. And the thing about calories as well is you want to eat nutritious calories. So the more nutritious your diet, like the better quality energy you're going to get. So if your calories are empty calories like crisps and bars of chocolate, we know we don't get the same energy out of those food sources. So to be very clever with those extra calories as well. And then the first 1,000 days. So there's a big study that shows that the nutrition that babies are exposed to from the time that sperm met that egg right up until your baby's about 2.5 years, the nutrition that they're exposed to does impact on their health in later life. Okay, so if baby was exposed to, or if you were exposed to good quality nutrition during the pregnancy, if baby was breastfed for as long as felt right for you, and if baby was exposed to good quality whole foods when you were starting them on solids at about the 6-month mark, and continued to offer them good quality foods right up until they're about 2.5 years old, those babies that were exposed to that really good quality nutrition for that 1,000 days from conception to 2.5 years, those babies go on to be adults who are less likely to suffer with cardiovascular disease, chronic illness, obesity, type 2 diabetes, So all of this nutrition does really give your baby, that gift of good health later in life.